everyone. Sorry, Professor. Okay. Thank you so much, my brother Rizky Basuki. Thank you so much, Professor Imam Waluyo. Today I have been assigned to be a moderator for Professor Sailen Ramehta. So, Professor Sailen Ramehta, you are now well known in Indonesia. Everybody knows you in Indonesia now, especially in what is called, especially related to this event. So today, I will be with you, guide you, not guide, actually, I will become a moderator for you. So please continue. At the end, I'll try to summarize what you have said during your presentation. So, Professor Sailen Ramehta, over to you, sir.
Good morning, everyone. Can you hear me?
Yes,
Very
sir.
well.
Very clear.
Well.
Yes.
Thank you, Dr. Arshad. Respected Dr. Imam, Professor Arshad from, I think, Sharjah University, Dubai. Then Dr. Rizgi, organizer and chairman, Dr. Ilamuddin. I don't know exactly name. And full organizing team of manual manipulative therapy Indonesia. Other participants, students, my colleagues. Good morning, everyone. Today, I got opportunity to share some of knowledge regarding the visceral manipulation, craniosacral technique, chiroprathic technique, and osteopathic technique. Those are very popular in present scenario, and we can treat so many conditions by the help of all these techniques. Autonomic dysfunction correction we can do by the help of this technique. We can correct our sympathetic, parasympathetic nervous system also. We can just break down the barriers. We can correct our muscular and bony pattern also, our body alignments also. So many things we can do with the help of all these techniques. So today we'll discuss something regarding that. So shall I share my screen, organizer? Hello, can you hear me?
Ya. Tolong Mas Rizky dikasih kesempatan buat
Oke.
Profesor.
Sudah, Pak. Silakan.
Go ahead, Professor. You can share now.
Okay. Okay. Myself, Dr. Shailen Mehta, Professor Janardhan at Rajasthan Vidyapeeth University, and since long back we are working with Dr. Imam and Kaya Padma Kumara Foundation also. So today we'll discuss something regarding the craniosacral therapy and other techniques, as I told you. So what do you mean by craniosacral therapy? It is a gentle hands-on technique that we use in light tests to examine membranes and movements of the fluid, mainly just around the central nervous system. Okay. So it is very useful in some of the autonomic dysfunction conditions. Craniosacral treatment is most often carried out with the patient lying down, fully clothed. A quiet and peaceful environment is the best place and best time and best condition to treat the patient. Treatment involves a very gentle touch of the practitioner hand. We can do movements since starting from cranium to sacrum and other body parts also, like shoulder joint, thorax we can do, lumbar joint. We can release the lumbosacral junction also, all the movement we can do. Then we can treat so many conditions like chronic pain, fibromyalgia, migraine, headache, facial adhesion, multiple sclerosis, neurological conditions, neurodegenerative diseases, TMJ joint disorders, strokes, post-confusion, post-distress syndrome, speech impairment, epilepsy. So many conditions we can treat with the help of the craniosacral therapy. And because of all these techniques, we can make the patient less stressed, calm. We can change the sleep pattern also. We can make the patient more focused on the activities, concentration, decision making, motivation. We can relieve from the headache also. So many things we can do with the help of the craniosacral therapy. Craniosacral therapy session is similar to massage therapy. Only here the patient should not remove the clothes. The treatment session begins with the consultation with your trained therapist. Soft music and lighting always play the extra effect on the treatment sessions. The therapist use gentle pressure techniques to assess an existence of the possible disruption or restriction in your facial system. Because mainly we are working with the fascias only. Superficial fascias are there, craniosacral fascias are there, deep fascias are there. Sometimes we are working with the peritoneum also. So all the soft tissue muscles also we are working here, ligaments also we are working here. So Mostly, there's so many techniques we are applying in the craniosacral therapy, like direct techniques. Sometimes we are applying, sometimes indirect technique, position release techniques also we can apply. Sometimes we can work for the disengagement also, and molding also, like the skull external forces applied to other counter of bones. We can use this technique with the help of molding also. So these type of pattern we used in craniosacral therapy, and we can improve so many conditions: allergies, birth preparation, relaxation, hyperactivity, headache, painful menstruation, sexual disturbance, sleep disturbance, backache, and other joint pain. There is some contraindication also. You cannot go in the case of the infection, acute infection like meningitis, encephalitis, or some open wound scar, skull fractures, dislocation, cardiac arrest, stroke, unclarified infections. You cannot go for all these techniques. So just remember this thing also while treating the patient. What is dysautonomia? You know about the autonomic nervous system, like the peripheral nervous system and central nervous system. So autonomic nervous system always deals with your involuntary movement. Sympathetic and parasympathetic and enteric nervous system is there. Dysautonomia refers to a group of medical condition with their problems with the autonomic nervous system functions. So that is called generally as the dysautonomia. So by the use of all these techniques, we can treat the autonomic dysfunction also: blood pressure, breathing pattern, digestion, heart rate, kidney function, pupil dilatation, sexual function, body and skin temperature regulation. All the things we can treat with the help of. What are the common symptoms of dysautonomia? Sometimes you will feel the balance problem, sometimes chest pain, ongoing tiredness, nausea, vomiting. Then sometimes you will feel the sensitivity, light sensitivity disturbance also, visual disturbances also, sometimes difficulty in swallowing also. A lot of functions are there regarding the dysautonomia. So these are the some common dysfunction related to dysautonomia. Your autonomic nervous system is network of nerve throughout your body that control unconscious process. I told you earlier also, involuntary movement. It is not only working in your activity phase, it's working in your sleep condition also. So autonomic nervous system correction and movement pattern should be always right to function your body in proper pattern. Okay, remember this. So as I told you, autonomic nervous system always deal with the sympathetic, parasympathetic, and enteric nervous system. Sympathetic nervous system always responsible for fight to flight reactions, whereas parasympathetic nervous system working in opposite pattern to sympathetic nervous system, and it is mainly responsible for the rest and digest. Enteric nervous system also one of the very important part of the autonomic nervous system. It will manage your digest, food, and other activities also. So your sympathetic and parasympathetic nervous system creates a balance always. It should be working in the balance mode. It involves multiple forms of communication. Your nervous system uses chemical compounds produced by various glands in your body and brain.
Professor Salendra, Professor
Yes.
Salendra, I have some requests. If possible, you slow down, please.
Okay.
Sorry about that.
Okay,
Sorry.
because time limitation is there.
You really no. Forget about time.
Okay.
Just relax and go ahead. But we don't understand. Some of us don't understand. Sorry.
Okay.
Go ahead. Thank you.
Okay, so your enteric nervous system is also very complex. Some expert describe it as the part of the overall nervous system also, but especially it is the part of the ANS only. So these all three systems, either parasympathetic, sympathetic, and enteric nervous system, all are the very important to work properly for the ANS, mainly autonomic. So craniosacral therapy, we can do so many movements with the membrane also, cerebrospinal fluid also. We can do the movement with the muscles also, other soft tissues also. We can do the movement with the sutures of the cranium also. Sometimes we can work on the temporomandibular joint also. Then we can release the pressure in the craniosacral junction also. We can release the pressure on the cervico thoracic junction also, and we can do the release the pressure on the muscles also, pterygoid muscle, buccinator, temporalis, all the muscles also we can work. So by the position of our hand and light gentle movements, we can change so many conditions, and we can treat the all the dysfunction related to the autonomic nervous system. Okay, so it's a very important system for our body. You can see a lot of nerves are there related to autonomic nervous system. Everywhere it's supplying sympathetic and parasympathetic nervous system. So so many regions behind the autonomic nervous system dysfunction. Sometimes you will get because of the neck pain, shoulder pain, back pain also. Sometimes you will get because of the office work also. Some regions like migrated from other countries or states also. Suppose I am going to Indonesia from India, maybe I will get the ANS dysfunction. Sometimes it's because of environmental and social factors also. Sometimes it is because of the change of work and workplace also. Sometimes because of your personal life also. Lot of reasons are there behind the autonomic nervous system dysfunction. Okay. So one recent one inventory that is called as the Holmes and Rails inventory. So therefore, specific activity there is a fixed points. So you can calculate the your life stress and your chances of the health breakdown in coming 2 years by the giving some points from this inventory. Just check here. If your score is less than 150, there is a low amount of change and a low susceptibility to stress-induced health breakdown in coming future. But if your score is 150 to 300 points, 50% chance of health breakdown in coming next 2 years. Just see, you can check by individual also. A lot of activities are there. There is a special point for the all the activities. So we have seen so many cases post-COVID era also with the autonomic nervous system dysfunction. Like if the score is more than 300 point, then 80% chances for your health breakdown. So just see how much stress you have in your life and how much the chances for health breakdown in coming future by the calculating point from this inventory. What happen autonomic nervous system mainly whenever you will get any change because of stress, because of pain, because of any socio-economical factor, because of any financial factor, so many reasons are there as I told you, then your autonomic nervous system will get affected and dysautonomia will develop. Okay, it is the medical condition because of the disturbance in functions of autonomic nervous system functions. Okay, so maybe psychological condition, maybe social economical causes, maybe sometimes because of global crisis. You know, we are living in the world of competition, so many global crises are there. Sometimes because of the personal reasons also. So a lot of factors are responsible for dysautonomia. What happen whenever there is stress, autonomic functions will change in dysautonomia. When you will release that stress or you will make the condition of the ease, automatically the dysautonomia will comes down to autonomia and your condition will improve and you can treat the patient in so many ways. You can see the in the present scenario better skills, better jobs opportunities, then better education. Lot of factors are responsible for the changing in the environment and changing the digitalization is there, financial digitalization is there, and risking evaluation, preparing 1 billion people for tomorrow's economy. So a lot of factors are responsible for the autonomic dysfunction. So all these conditions, we are living in a present scenario. We have to deal day by day with all these conditions. So a lot of chances are there for dysautonomia. See, muscular pain, cardiovascular disease, hypertension, increased inflammation, gastrointestinal disturbances, then deficiency, diabetes, hypertension, anxiety, everything is responsible for your dysautonomia. And we have to make it correct by correcting the auto. Whenever the speed our environment changing is in conflict with our biological evolution, then stress will become stressor. Then very difficult to deal with that. Okay, just remember always. Whenever the stress will become the stressor, very difficult to treat that. And lot of researches are there regarding dysautonomia, especially after the COVID era. I have seen a lot of patients with the autonomic dysfunction, and reason may be different regions because you know the after COVID, you can see the changes in the breathing pattern also. You can see the changes in the temperature, body temperature pattern also. You can see the changes in the that cardiorespiratory functions, digestive functions also. So many complications you can see in post-COVID era. A lot of research are there. So everything you have to improve, okay, by your, see, either stress from your TMJ joint to your cervical region, shoulder region, lumbosacral region, hip region. But whenever the stress is there, definitely your autonomic dysfunction will change and dysautonomia will develop. You can change the world and make it a better place. It's in your hand to make a difference between the normal and abnormal. Always remember, by our corrections, by our techniques, we can change the world and make it a better place for living for the human beings. Okay, you cannot change the direction of the wind, but you can adjust the sails. Always remember this thing. So always just try to correct the autonomic dysfunction by various techniques, as I told you. Either it's because of musculoskeletal pain, cardiovascular disease, hypertension, increased inflammation, deficiency, poverty also one of the reasons, sometimes population, overpopulation, separation, unemployment. Definitely, it is also one of the reason. And long-lasting disease, chronic condition, sometimes it is also one of the reason for dysautonomia. So by the doing so many movements, we can change the dysautonomia. Dr. Ashad, it is the right speed now? Hello? Hello?
Yes.
Yes, yes,
It's
yes.
it's okay.
Very good now. Very good. Very good. Go ahead, Professor.
Or shall I reduce more, or it's
No,
right?
better now. Better now. Better now.
Okay, okay, Dr.
No
Ashad.
more
Thank you.
complaining. No more complaining.
Okay, thank you, Dr. Ashad.
Thank you. Thank you.
And I will show you some of the practical techniques also. Before that, we'll go for the facial system. As I told you, for all these techniques, we have to deal with our body's soft tissues. Okay, soft tissues, superficial facial system is there. Then we have the deep fascias. Then we have the visceral system. A lot of visceras are there in our body, abdomen region. All the viscera, stomach, liver, pancreas, gallbladder, small intestine, large intestine, so many visceras are there. Then we have to work with the craniosacral system also. Remember this thing, craniosacral therapy. So what happen? We always have to work on the area of concentration of the highest HA concentration, high ionizing acid. Okay, we have to work for high ionizing acid areas concentration. Then we can improve the condition of the soft tissues. Okay. Then so many muscles are there. As I told you, superficial also and deep also. Fascias also, muscles also. Then when we are talking about the fascias, then and the facial region, then we can work on the temporoparietal fascia. We can work on the buccopharyngeal fascia in craniosacral therapy. Sometimes we can work on the parotid mesenteric fascia also. Sometimes we have to pterygoid fascia also. Sometimes sternocleidomastoid fascia also we have to work. Lot of fascias are there. Okay. So sometimes we have to work on the sutures also. It's depend on the condition of the patient. Okay. The relationship between structural and visceral system is through mesenteric or ligaments always. So these are the soft tissue structures, and the relationship between the structural and cranial system is through the intraspinal membranes. You remember this thing also. So we have to work on all these structures just to correct the soft tissue patterns. Okay, sometimes we have to work on the relationship between visceral and cranial system also. You know about the peritoneum also. Visceral and parietal peritoneums are there. Then again divided into peritoneum cavity. Some of the organs are the intraperitoneum, some of the organs are the retroperitoneum. So both the organs we have to work. Stomach, spleen, liver are the most common intraperitoneum organ. There, whereas the head, neck, body of pancreas, and descending colon, duodenum, all are the retroperitoneum organs. So we have to work in all the organs. Just see the diagram here. You can see clear cut the peritoneum cavity, visceral peritoneum, and the parietal peritoneum. Then you can see here the transverse colon, greater omentum, lesser omentum. All are the soft tissue structure. Okay, mesentery. So we have to work on all these soft tissue structure. Transverse colon, then sigmoid colon, greater omentum, lesser omentum, all the soft tissue structure we have to work for the just correct the our autonomic dysfunction and other bodies dysfunction. Not only the autonomic, other bodies dysfunction also. We have to deal with the soft tissue structures. Okay, mesentery is a continuous set of the tissue located in your abdomen. You know this thing. It attaches your intestine with the abdominal wall. So whenever you will correct the abdominal wall pattern, definitely the mesentery will also improve. Okay, transfer colon attached to the anterior wall of the pancreas duodenum also. So just to correct all these viscera, you have to work on the soft tissue. Like sigmoid mesocolon, again, it is attaching with the pelvic wall. So whenever you work on the pelvic wall, definitely these viscera also will improve. Okay, so everything is related. Then greater omentum and lesser omentum. While correcting the viscera, you have to work on the lesser and greater omentum also, because the small and lesser momentum, or we call as the gastrohepatic omentum also, it is always attached with the liver, stomach to the duodenum. So when you are working on all these three viscera, definitely, or this omentum, definitely the pattern of all these viscera will correct. We have to find out the barriers, we have to find out the problem, then we have to work on all these viscera. Same thing for greater omentum also. If you work on the transverse colon or stomach, definitely these viscera will improve. Okay, so how we'll correct the autonomic dysfunction? By resetting the autonomic nervous system. Okay, as I told you, always the sympathetic and parasympathetic function will work in opposite pattern. One is working for the fight and flight reaction, whereas another is working with the rest and digest. So if the balance is there, everything is going on smoothly. If there is any disturbance, definitely the balance will the change. Okay, and the three most important part of ANS, I told you earlier also: sympathetic, parasympathetic, and enteric nervous system. Okay, so sympathetic, division of nervous system that function produce localized adjustments such as the sweating response, increase or decrease the temperature, whereas the parasympathetic always deal with the feed and breed activities. Enteric nervous system, sometimes so many persons used to call as the part of the brain and spinal cord also, but it's generally working with the vagus nerve and prevertebral ganglions in our body. So we have to work on the prevertebral ganglions and sometimes the postvertebral ganglions also to correcting all these things. Okay, one by one I will tell you for the all the major visceras where we have to work. See here, autonomic nervous system deals with the lacrimal gland, salivary gland, heart activities, then respiratory tract, stomach, small intestine, kidneys, uterus, bladder, rectum, everywhere it's working. So whenever you will correct autonomic dysfunction, definitely your body's everything will improve. Okay, sympathetic, the mainly origin of fibers from the thoracolumbar region. Okay, then here again the length of fibers and location. Length of fibers for the sympathetic, short pre-ganglionic and long post-ganglionic fibers, whereas the location close to the spinal cord. So you have to work to correct the sympathetic nervous system close to the spinal cord. Remember this thing. Whereas the parasympathetic, brain and sacral spinal cord, the origin of the fibers. And the length of fibers, long preganglionic and short postganglionic fibers, always you have to work. Whereas in the visceral effector organs, you have to work for the location of ganglia, not in the spinal cord this time. That is the different pattern for the sympathetic and parasympathetic. Okay, always remember this thing. And what are the common clinical feature? If we are talking about the digestive organs, then increase the peristaltic movement, sometimes because of the sympathetic decrease also. Opposite pattern, because I told you both are working in the opposite manner. Gallbladder, the parasympathetic will increase the constriction, whereas the sympathetic will improve the relaxation. So everywhere, bladder, penis, vagina, iris, respiratory, you can see the opposite pattern for the sympathetic and parasympathetic nervous system. Enteric nervous system, always working with the vagus nerve and prevertebral ganglion. You have to work on the prevertebral ganglion. So mainly the Orbit's fracture and mesenteric fractures are the part of the enteric nervous system. So whenever you will get any problem in esophagus stomach, you have to work on all these ganglions. So don't forget to, because the enteric nervous system is also very important part of the autonomic nervous system. Sympathetic nervous system, preganglionic fiber are in the thoracolumbar region. I told you earlier also. So you have to work on the thoracolumbar region. Okay, T1 to L2. The postganglionic fibers along the vertebral column, sympathetic chain, pre and paravertebral ganglia, you have to work for the correcting the sympathetic nervous system. Then parasympathetic nervous system here. Preganglionic fibers arises from the central nervous system, nuclei of the third, then seventh, ninth, and 10th cranial nerves. Then sacral region mainly from the S2 to S4. Okay, postganglionic fibers arising from the near to the visceral effector organ. So you have to work for with the viscera to correct the parasympathetic pattern. Remember this thing. Then red flags. Whenever you will going to treat the viscera, first you have to check for the so many red flags. I will show you in the practical class afterwards. Like Murphy's sign. If you have any problem in the gallbladder, cholecystitis and all, you have to go for the Murphy's sign. Check Murphy's sign. You should know the location of the gallbladder, then only you can go for the Murphy's sign. Then Bumble sign also you can check for the appendix. You know, appendicitis is a very common problem in the human beings. So these things also you can check by your visceral red flag techniques. Then abdominal aorta pulsation also in the center part of the abdomen you can check with the technique. Then stomach, liver, then small intestine, duodenum, ascending colon, descending colon, ileosacral bowel, everything you can check with the your assessment technique. Okay, then only you can treat. You should know the proper location also. because we have divided the abdominal quadrant in 9 parts: right hypochondrium, then left hypochondrium, epigastric, and there is this fixed location for all the viscera. So if you are going for the assessment and treatment, you should know the proper location of the viscera. Then only you can treat the patient in proper way. Okay. Like for stomach, sympathetic nervous system, if you want to correct, post-ganglion fiber originated from the pre-aortic celiac ganglion. So you have to work on the pre-aortic celiac ganglion. If you want to correct the pre-ganglionic fibers, then you have to work on the T5 to T9 in the spinal region. Remember this thing. If you want to correct the parasympathetic nervous system, post-ganglionic fibers originate from the oribus flexus. So you should work on these flexes only. Whereas the preganglionic fiber originated from the vagus nerve. So you have to work there. Okay, then only you can correct the sympathetic and parasympathetic nervous system for the stomach. And you can correct the stomach problem, gastritis, and so many problems with the stomachs. So by working with all these ganglion, you can correct that also. Okay. Like sometimes you will get the difficulty in swallowing, sometimes retroesternal burning also, sometimes nausea also, vomiting also, indigestion also. Sometimes dysphagia also will develop in some patient in autonomic nervous system dysfunction. Sometimes slow digestion also, ulcer also, gastritis also. So by treating all these ganglion for the parasympathetic and sympathetic, you can treat the stomach problems. Okay. Again, you can work for the lesser momentum for the stomach because it's originated from the stomach only. Or you can work on the pre-aortic celiac ganglion also. For dorsal segment, you can work on the T5 to T9 to treat the stomach. Again, secondly, I'm telling you. Or you can directly work on the stomach also. You should know the location of the stomach. Then only you can work on the stomach, one by one. Liver, for sympathetic nervous system, post-ganglionic fiber originated from the pre-aortic celiac ganglion. So you have to work there. Pre-ganglionic fibers originated from the, again, same like the stomach, T5 to T9. Okay, so you have to work there. Then parasympathetic, again, pre-ganglionic fiber originated from the vagus nerve. Post-ganglion fiber originated from the ganglia located on the choledochal gallbladder hepatic hilus. So you have to work there. Remember this thing. Okay. For the liver is a major organ. So many problem with the liver also. Sometimes you will get the pain in the hypochondric region. Sometimes you will get the neck pain. That sometimes it is associated with the liver also. Right shoulder pain also sometimes you will associate with the liver. Headache, migraine also. Whenever you get the problem in liver, sometimes you will get the headache, migraine also, itching also, arrhythmia also, jaundice also. Okay. So again, I am repeating for the liver, pre-aortic celiac ganglion you have to work. So for dorsal segment, you have to work in this T5 to T9 thoracic preganglionic fibers. And direct treatment for liver, I will show the direct treatment techniques for the liver and all these things. Just wait for some time. Then small intestine, again, sympathetic nervous system, you have to work on the post-ganglionic fiber originated from the pre-aortic superior mesenteric ganglion. It is located at the level of T12 to L1. Whereas the pre-ganglionic fiber originated from the T9 to T12. There, T4 to T9, okay, for liver and stomach. But here, T9 to T12. So leisure splenic flexus also you can work here. Whereas the parasympathetic nervous system, post-ganglionic fiber originated from the oribus flexus and mesenteric flexus. Both are the important flexure for enteric nervous system. Okay, so you have to work there also. Pre-ganglionic fibers, again here vagus nerve. For all these three, so you have to work on the vagus nerve. Okay, here so many problems related with the small intestine. Sometimes you will get the pain at the sacroiliac joint. Sometimes you will get the pain at the dorsal 12 thoracic vertebrae also. Sometimes D9 to D12 also. Sometimes you will get the chronic tiredness also. Sometimes you will get the feeling hungry all the time. Okay. Then sometimes your belly will swell. Sometimes night cramps and joint pain and calcium and iron problems. So you have to work with all the points related to small intestine. So you can improve all these things. Okay. Again here, repetition of the points. So I already discussed like lumbar zone L1 to L2 for the treatment, then dorsal zone T12 to or T10 to T12 or T9 to T12 you can work. Then post-aortic superior mesenteric ganglion also you can work here. Colon, the large intestine. Here, superior and inferior mesenteric plexus of origin you have to work. Mainly the lumbar, second to lumbar, third vertebrae. Then here, preganglion fiber originated from the T9 to T30, so you have to work there. For the parasympathetic nervous system, you have to work on the mesenteric flexus and orifice flexus again. So definitely you will get the improvement. Then so many problem with the constipation is the main problem with the colon. When you will check the red flags, you will get the constipation and tightness in that particular area. It is the main problem for the most of the participants. Then abdominal bloating, then sometimes weakness, tiredness also. And again here, I don't want to repeat the points, like the pre-aortic mesenteric inferior ganglion located at the level of L2, L3. So you have to work there. Then thoracic T9 to T12 or T10 to T12, you have to work. So sometimes you will work on, you can work on the sacrum also, because lumbosacral junction also plays very important role in the colon dysfunction. Okay. The mediastinum cavity, you have to mobilize the mediastinum space also. You know, lot of organs are there in mediastinum also. Okay, so if you want to work, diaphragm also very important to treat the mediastinum cavity. So you should know the dysfunction of the diaphragm, how you will locate the diaphragm and where you have to treat for the diaphragm. Okay, thorax also again for sympathetic nervous system, preganglionic fiber originated from the cervical ganglion C7 to C1 to C7, whereas the dorsal ganglion lies at the level of T3 to T10 or T9 sometimes, because after T9 to T12 we have to work for the abdominal viscera. Preganglionic fibers originate from the T3 to T9 or T10 again. Post sympathetic nervous system, post ganglionic fiber originate from the nuclei on organ walls. So we have to work there, and vagus nerve. Most of the viscera by vagus nerve only. Okay, so diaphragm technique, you can treat the thorax. Then clavicle mobilization, by mobilizing the clavicle also you can treat the thorax. Then sometimes you can apply the thoracic tissue techniques also. Sometimes you can work T3 to T9, that will also help to correct the symptoms of the thorax dysfunction, like thoracic pain, dorsal pain, neck pain. Sometimes breathing pattern will change, sometimes breathing difficulty, sometimes you will get the pain on the palpation. So you can correct all these things by them working on the thorax. Okay. Then TMJ and head dysfunction also. So TMJ joint, sometimes you have to mobilize or give some osteopathic technique to TMJ joint also. Sometimes you have to do some soft tissue manipulation to the TMJ joint also. Like post-ganglionic fibers originate from the superior and inferior cervical region, and pre-ganglionic from the cervical 4th to cervical 8th. Okay, so you have to work there also. Then post-ganglionic fiber originated from the intramural ganglions, so you have to work there also. And sometimes the cranial nerve nuclei like the 7th, 3rd, and 9th also, so you have to work. Because sometimes you will get the headache in the facial region, sometimes occipital migraine, tiredness, blurred vision. Then other symptom also you can treat with the treatment of the TMJ and head. Okay, so this technique also you can apply. Then I will show you. Should we go for first? We'll finish for the some of the theory part. Then I will show you some of the techniques. You know about the you. I think you heard about the osteopathy and chiropathy also. So what do you mean by osteopathy? How you will define the osteopathy? Because osteopathy is the way of detecting, treating, and preventing health problems by moving, stretching, and massaging. What are the three things? Moving, stretching, and massaging person's muscles, joints, and soft tissue. That is a very simple technique of the osteopathy. Okay. So sometimes we have to stretch, sometimes we have to move, sometimes we have to mobilize, sometimes we have to give the traction. See the different position. So by doing all the things with our muscles, soft tissue, and bones, we can treat and we can correct so many bodies disorders. So it's a very popular technique in present scenario. And here for osteopathy, we are applying and we are treating so many things, like the you know about the myofascial release technique also, muscle energy techniques also, position release technique also. I think you heard about all these. Sometimes we are applying the high velocity, low amplitude thrust also for different joint. So a lot of things are there regarding osteopathy also. And by usage of osteopathy, we can treat the arthritis also, joints pain also, back pain also, shoulder pain also we can treat, headache also we can treat, TMJ joint dysfunction also we can treat, and we can treat the postural problems also. We can correct the posture also. Okay. Next slide, I will discuss a little bit about the posture again. Then we can treat the neurological problem like neuralgia also. So it's very useful. Only remember some of the contraindication also while treating the patient. If the elderly patient, just take the extra precaution. Some patients are osteoporotic also. Sometimes patients having dislocation and fracture also. Stroke patient also. Sometimes IVDP cases also. Sometimes if the patient is having more neurological problem, bowel and bladder problems, so just avoid the osteopathy. Okay, these are the contraindication for the osteopathy. Just remember this thing also. Okay, then we have to work with the soft tissues mainly in the osteopathy. And I told you so many technique for the working with the soft tissues. We have to find out the barrier, then we have to break down the barrier. So we can do this thing with our hands mainly. There, here we are not taking any instrument, we are not using any medicine. Everything we have to do with our hands only. Okay, soft tissue manipulation. See, just see the some of the diagram how we can do the soft tissue manipulation. Practically, I will show you. We can reduce the muscle hypertonicity. We can reduce the muscle tension. We can reduce the facial tension, muscle spasm. So many things we can do with the help of our hand. Okay, restricted motion also we can improve the texture of the tissues also. We can change the sensitivity also. Lot of things we can do with the help of osteopathy. Okay, we can stimulate the stretch the reflex also. We can promote the relaxation to the patient also. Lot of things we can do with the help of the osteopathy. So here sometimes acute pain and acute strain also we can improve. Okay, fracture and dislocation cases generally we are not going for the infection also we are not. Malignancy cases just avoid all these things. Okay, then myofascial release technique, one of the popular technique of osteopathy. You know about MFR. Sometimes we are giving MFR to particular soft tissue and joint related restrictions also to improve the such condition. Very, you know how we can give the MFR. We by the placing our hand, we can give the myofascial release. We can do. So it's very good technique for the osteopathy. Then sometimes we can apply the MFR directly also, indirectly also. Sometimes we are using only single hand, sometimes we are using the both hand. So here also, just take care about the precautions also and contraindication also. Then counter strength technique also, very important technique for the manipulation of the soft tissue bones and muscles. You know, counter strength techniques also. Here, mostly we are applying the pressure in the opposite direction. Okay, so that technique also we can use for the mobilizing the muscles of tissue and bone sometime. Okay, I am showing the counter strength techniques also for treating so many conditions. So here again, just take care about the contraindication. Then muscle energy technique also. You know about the muscle energy technique also. It is also very popular technique to treat the muscles. Okay, so here mainly we are working with the somatic dysfunction through the stretching and muscle contraction. But very popular technique in present scenario. Okay, muscle energy technique are contraindicated in patient with the fractures, neoplasm, any oncology patient, crush injury is there, joint dislocation is there, fracture is there, pregnancy. Just remember, whiplash injury, spinal fractures is there. So remember all these things while doing the all these osteopathic techniques. Okay, see here MET, how we are giving the MET to the different patients. Again, here direct and indirect method for all the techniques. Then position release also, very good technique. We are putting the part in some special position to automatically release from the barrier. It is very good technique. We can apply for the spine also. We can apply for the shoulder joint also. Very good technique, position release also. Okay. Then sometimes we are going for the other techniques also. You know, so you should know the indication and contraindication for other technique also. Then high velocity, low amplitude technique also. Sometimes we have to go individually joint wise, like the knee joint, ankle joint, shoulder joint for HVLA techniques. It's very good to remove the barriers or just to break down the barriers so we can improve the joint condition. Okay, so here also some of the contraindication. Just remember all these contraindication while performing the HVLA technique. You should know about the force and duration also. How much force you are applying, how much duration you are giving this technique. Remember all. So you know the position of the part is very important while giving the HVLA technique. So you should take care about that also. Then you should go for the other technique like visceral techniques. As I told you, so many viscerals we have to correct by our visceral techniques. Everything you have to do with your hands very softly and gently. Then you can, I told you the location also, all the sympathetic and parasympathetic nervous and the enteric nervous system ganglions. So if you work there properly with your hands, you can improve the visceral condition also. Okay, osteopathic visceral technique are defined in the glossary of the osteopathic terminology by the Education Council of the Osteopathic Principles. a system of diagnostic and treatment directed to the viscera to improve the physiological function of the viscera, not the anatomical function. Remember this thing, not the anatomical function. Always remember, if you want to improve the physiological function of viscera, you can go for the visceral techniques. Very simple. Okay. So many techniques. Red flags, first you have to identify. I told you so many red flags also. Then you can treat the individual viscera also. Here also so many contraindication. Then we have to treat the postural dysfunction also. You know about the normal posture. Okay, so you should aware about the posture. You should deal with the dynamic principles of your body. You should know about the functional anatomy and physiology also. Then you should know the role of the osteopathic and visceral technique also. And you know about our dynamic, static, good and bad posture also. Our normal, what is the normal posture? Our body's alignment should be in the proper position. Every part of the body should be that only we can tell the normal posture. So it should be either in the static condition also and dynamic condition also. So by the applying all this, you know about the bad postures and poor postures. See here some of the slides: good posture, poor posture, kyphosis, lordosis. You know about the rounded shoulder posture. So many type: forward posture, flat back, sway back. So all the posture dysfunction also we can treat with the help of our these techniques. Okay. So we should apply all the time correct posture only, either with the sleeping, either with the sitting, either with the doing activity, standing. So sitting on the chair, sitting on the car seat, every time we have to deal with the good posture. Gravity have very important role to maintain our posture. You know about that. See some of the slides for all the bed posture pattern. So here also we can improve everything. Just see the depends on the center of gravity and light of gravity and base of support. If you all these three things should be in the proper coordination and alignment, your posture will be always good. So you have to work on all the soft tissue to correct the posture also. Okay. So again here, kyphosis, flat back, sway back, forwarded posture slides. So posture is the personally every individual having different posture. So we have to work every individual age per the need of the. You have to work in the sagittal plane also, frontal plane also, and transverse plane also. Everybody is saying either left sided posture or right sided posture. You can check by the some of the postural test for the checking the dorsal spine and lumbar spine for the see here right sided posture deviation and left sided posture deviation, and it's depend on the iliacum tilt only, because you know the hip bone, sacrum and ilium. So mainly the posture will get affected from the ilium and sacrum only. So it's depend on there only. Then you have to work on the some of the bony component and muscular component just to correct the posture. Okay, so muscular chains you have to work. Sometimes you will get the left sided posture deviation. Just see the slide here. Sometimes you will get the right sided posture deviation. Different posture is there. Okay, so you have to correct these pattern with the working on the bony and muscular component as per the need of the patient. Okay, like the if you have the left sided deviation, then anterior right muscular chain of the lower limb you have to correct. If right sided, then elongation of the anterior left muscular chains of the lower limb you have to do. So both the direction either right, you have to work on the opposite group of muscle. Then only you can correct the posture. Okay. Muscle behavior involved in the pelvic behavior for anterior iliac tilting. Mainly you have to work on the rectus femoris, quadratus lumborum, TFL and sartorius muscle. Okay. For the anterior iliac attitude of the patient. If you have the posterior iliac attitude, you have to work on the opposite group of the person. Psoas, piriformis, femoral biceps femoris, and gluteus. Then only you can correct the posterior attitude. Both the attitudes are different. Okay. So these are the main muscle to correct all the attitude, because the nutation and counter nutation are the main forces affecting the movement of the hip bone and the pelvic bone. So you know how to correct by working on all this. Then diaphragm also very important role to correct the all the, because viscera and diaphragm are interconnected. Diaphragm is the major muscle. So you have to work on all these also just to correct all these pattern also. Okay. Then one by one, all the joints also you have to work by the osteopathic and chiropathic techniques and visceral manipulation to correct your postural problems. Sometimes you have to work on the foot, sometimes you have to work on the knee joint, sometimes you have to work on the pelvis, sometimes you have to work on the lumbar spine, sometimes you have to work on the dorsal spine. So many things are there. Okay. Then sometimes you have to work on the viscera also, because I told you sometimes you will get the neck pain because of the liver problem. Sometimes you will get the cervical pain because of the colon problem. So sometimes you have to work on the viscera also. Viscera means you have to work on the diaphragm, you have to work on the liver, you have to work on the uterus, you have to work on the urinary bladder, sometimes you have to work on the rectum also. Okay, so many things, every viscera you can treat, or everything you can treat by the your movements of your techniques and movements of hand on. Craniosacral therapy also, I told you, you have to work on the cranium, you have to work on the sacrum, you have to work on the other body parts also. Sometimes you have to work on the TMJ joint also. So everywhere you have to work just to correct. No, see, I will show you some of the practical techniques for Dr. Arshad. Can you hear me?
Clear. Go ahead. Yeah, I really enjoy. So that's why
Yes.
I really enjoy.
So do we have more time?
Excellent.
No, do we have some more time? We can go.
Yeah. You have 3 to 5 minutes, please.
Okay, then I will show you some of the techniques.
Go ahead.
Okay.
Go ahead.
Yes, just I will take the model and change the direction. Just a minute. Okay, so see, for craniosacral therapy, as I told you, we have to work with the membrane and cerebrospinal fluid. So the best position, patient should be always in the comfortable position. So we can go for the movements, we can treat so many things at the here. Okay. Cervico-occipital junction also by the help of the movement of our hand. Sometimes we can do some movements with the help of our tips of the fingers. We can give the distraction also. We can mobilize the membrane also. We can move the fluid also. Sometimes we have to work on the sutures like frontal, temporal, all the suture we have to work. We have to place the part in the proper relaxation position. Then we can treat. Sometimes we have to give a little bit traction also to the part. Okay. Sometimes we have to work on the soft tissues also, like the fascia, temporal fascia, then buccinator fascia, pterygoid fascia. Sometimes we have to give some knitting to the fascia also, like lateral pterygoid or the fascia of the. Sometimes we have to provide the TMJ joint soft tissue manipulation also. Sometimes we can do the HBL technique to the TMJ joint also, or cervical region also, by placing our different placement of our hand. So everything we can do. Or sometimes we can work on the shoulder also. Okay. By just placing the scapula in the proper position, and we can relax the shoulder also. Make the patient just take near to the you and stabilize the scapula, and you can do the movement for the shoulder joint also. Sometimes you can mobilize the clavicle also. Just as I told you, just hold the clavicle in proper position and move the shoulder and mobilize the clavicle. So many things you can do. Or sometimes you can mobilize the thorax also. Just put the place the patient's hand from one on the scapula, one on another shoulder. Just lift it like that, and then place one hand here. Then turn the head on another side. Then just take the patient to unfold the hand and put some pressure on the thorax. So by this technique, you can mobilize the thorax also. Lot of things you can do with the patient to mobilize the thorax also. Then I told you the just find out the all the red flags. So you can find out for the cholecystitis also, you should know patient at the level of the 10th rib angle. Then you can find out for the liver also by finding out the red flags. You can work on the diaphragm also, and you can work on the ascending colon also. If you know the proper location, you can work on the descending colon also, and you can work on the transfer colon also. You can mobilize the linea elbow also. If you know the proper position, then you can mobilize the linea elbow also. You can work on you can check here Bumback sign also for appendicitis. You should know you can go for the iliosacral bowel assessment also. Then you can go for the sigmoid colon also. And a French angle, you can treat the diaphragm also. You can do this technique in the sitting position also. Okay, you can apply in sitting position also. Then you can feel the aortic pulsation also by placing the hand in proper position. You can find out, you can treat here pre-aortic ganglion also. If you want to mobilize the dorsal spine, then also you can do so many things. Then take the patient near to closer to your body parts Then again place the hand in proper, one on the scapula, one on the another hand, turn the head on another side, then lift the patient and just fold both the legs also and release the dorsal ganglion by placing the hand like that. You can release all the dorsal, whatever you want, T90, T12, or sometimes lumbar region also you can release. Okay, what you can release in the sideline also, like this technique also you can do. Just place your hand on the dorsal region, put your hand here. After placing both the hand, and you can release like that also by giving this. Okay, or you can release in the prone position also. Just make it prone. Okay, place both the hand here. Okay, or you can just place the your both the hand with, on the vertebrae where you want to release either T8, T9, T12, and after placing the hand, you can apply the thrust manipulation, and you can give the HBL technique. You can treat the dorsal ganglion. Okay, then spine again. If you want to relieve the pressure on the hip joint, then again you can relieve. Just fold one leg, put one pressure on the and hold the sacral bone, and just mobilize the full lower limb. So you can relieve the pressure in the lower limb also. Slowly, slowly you have to mobilize it. So you can relieve the pressure on. If you want to relieve the pressure on knee joint, you can work on knee joint also. If you want to pressure on the relieve the ankle joint, you can work on the ankle joint also. Okay, different pattern is there. Okay, or if you want to use some HLL technique to ankle joint, you can use that also. You should know about the pressure, force, and time. How much pressure you have to do, how much pressure you have to apply. Remember all these things. Okay, if you want to treat the particular viscera, you can go for the different viscera location. First check for the red flags, then go for the individual viscera treatment also. Diaphragm you can treat at the phrenic angle. If you want to treat the liver, just go at the level of the T8 to 9 rib angle. If you want to treat the appendix, you have to go at the level of the, you know about the appendix also. So you near to iliosacral bone. If you want to go for the sigmoid colon, just go just a little bit above from the iliac bone, ASIS. Okay. Then you can go for the sigmoid colon. If you want to go for the transverse colon, just go in the center. If you want to release the lesser momentum, because you know it's from stomach to anterior part of the abdominal wall, so you can release the lesser momentum also. If you want to release the greater momentum, so you can release the greater momentum also. So different things you can do with that. Okay. Then you, if you want to apply the all the HVLA technique or position release MFR, I told you. So you can release the muscles also by MFR technique, or position release. You can counter technique also you can apply. Like if you want to release the scapula, just apply the pressure in opposite direction. Put the hand like that and apply, move the one hand in another direction and another hand in opposite direction. So then position release also, just place the some part in particular position. If you want to release the pressure on the sacral region, put the leg in another position, automatically the pressure will relieve. That is called as the MET also I told you. If you want to release the pressure on the lower limb calf region, then go for the MET. That also you can do. Okay. Then if you want to give some HBL to dorsal region, then also they place the patient in near to the therapist, then place both the hands and flex one of the leg, then just apply the counter pressure on both the direction, then you can go for the other techniques also like that for the back region. If you want to mobilize the cervical region, that also you can do in this position. Okay, just apply a little bit traction, place the hand in the proper position and do in the both. Then you can go for the HBLA technique for the cervical region also. Different techniques are there.
Excellent, excellent,
Okay.
excellent.
Hello?
Yes, excellent. I just want to, Professor, I just want to add one more contraindication, and then can you hear me?
Yes. Contraindication.
No.
Mainly
my contraindication is different because if my patient is girl or woman, this is really contraindication for me.
no, girl and woman, you have to, while do, if you are working somewhere in the thoracic region, you should take the use of one towel or pillow. Then you can go for this mobilization.
Okay.
I am doing for the girls patient and females patient also. When you will see, we have to treat either the male or female if patients are coming to our clinic. So you just take care. If you are doing for the girls and women, use some pillows and towels. By placing the pillows and towels in proper position, you can go for the girls and women also.
Okay, clear.
Okay.
Clear. Okay, Professor Sailen Rameta,
Yes.
I really appreciate, and then I would like to say that one of an excellent presentation that I have ever moderated before. This is really excellent. Okay, you explained to us not only the techniques but also the anatomy, physiology, especially related to this therapy, craniosacral therapy, and what is the name? Osteopathy. What is the name again?
Osteopathy, visceral manipulation.
Yeah, postural manipulation. Okay, let me explain. I have write down some information to the audience. Okay, so Profesor Salin Rahmeta, thank you so much. Oke, teman-teman semuanya, saya akan summarize, ya, saya akan summarize apa yang telah disampaikan oleh Profesor Meta, terutama yang terkait dengan craniosacral treatment, craniosacral introduction, yang bisa digunakan, ya. Profesor Meta sudah menyampaikan kepada kita, ya, bahwa craniosacral itu bisa digunakan apabila pasien lying down, ya, berbaring, fully clothed dengan full patient, di tempat yang quiet, peaceful environment, artinya untuk menjaga privacy di sini. Saya kira itu yang paling penting. Kemudian yang kedua adalah yang paling penting, beliau menyampaikan kepada kita condition that related to what is called craniosacral can help. Apa yang bisa membantu untuk craniosacral ini, misalnya chronic pain, fibromyalgia, migraine, partial adhesions, multiple sclerosis, neuralgia, stroke, temporomandibular joint syndrome, TMJ, kemudian post concussion, post-concussion syndrome, speech impairment, and epilepsy. Yaitu ya ada beberapa yang untuk kondisi-kondisi yang bisa diterapi, yang bisa dibantu dengan craniosacral, ya. Kemudian beliau juga memperlihatkan beberapa gambar tentang craniosacral, ya. Kemudian apalagi yang beliau sudah jelaskan beberapa teknik, ya. Teknik palpasi treatment, ya. Beliau sudah menjelaskan ada 4 yang saya ingat itu adalah teknik direct teknik, ya, nanti disampaikan. Kemudian ada indirect teknik, kemudian separation or disengagement teknik, and molding teknik. Ini teknik yang penting untuk craniosacral ini, nanti dilihat lagi penjelasannya, ya. Mudah-mudahan nanti bisa di-sharing PowerPoint-nya. Kemudian indikasinya alergi, preparation of birth, mempersiapkan untuk persalinan, ya, relaksasi, hyperactivity, headache, tidur, sleep disturbance, kemudian nyeri punggung, itu indikasinya, ya, black cakes. Kemudian kontraindikasinya menurut Profesor Mehta, meningitis, acute inflammation, especially like meningitis, open wounds, septal and open wounds, skull fractures, cardiac arrest, especially acute pace, ya, stroke, acute pace, and infection, unclarified infection. Correct me if I'm wrong, Professor Mehta. There's some
Yes,
contraindication.
elderly people's
Elderly
osteoporotic
people.
people,
Okay, elderly people.
some
Kemudian
vitamin D deficiency, some malignancy.
malignancy, oke. Kemudian beliau juga menjelaskan ini tentang dysautonomia. This is really some of us, it is new terminology for us, ya. Disorder of autonomic nervous system, INS, ya, especially that generally involves failure of sympathetic and parasympathetic components of INS. Ya, itu jelas, ya. Kemudian beliau juga sudah menjelaskan symptoms of dysautonomia, balance problem, chest pain, tiredness, ongoing tiredness, nausea, vomiting, migraine, erectile dysfunction, ya. Itu
Sexual dysfunction, sometimes
sexual dysfunction,
indigestion,
ya, that's right.
acidity, gastric problems,
Gastric problem.
constipation,
Oke. Kemudian ada beliau menjelaskan,
sometimes neck pain, sometimes thoracic pain you will get. So many.
oke. Oke, kemudian apalagi ya, beliau sudah menjelaskan, you share us some pictures ya, really important picture, but it is better if after this, and then one important thing related to Holmes and Rahe stress scale for adults. This is really important. We can use it later.
You can calculate your score because
Yes.
you present scenarios or everybody is just in stress only. Work related stress is there, then family related stress is there, then financial stress is there. So many stress is there. So
Yes.
mostly the ANS will get disturbance because of any type of stress. See, we have passed from COVID era before 2 years only. So I have seen lot of young adults only. They are dying because of the heart attack. Okay, lot of autonomic dysfunction. So many researches came in last 2 years regarding the autonomic dysfunctions. Okay, so because of the post-COVID problems, some patients are having the blood pressure after the COVID. Some patients is having irregular heartbeats. Lot of problems are there. Some patient is having the problem with that body temperature also. Some patients having full of the blood chemistry will change. So everything we can improve by our autonomic nervous system correction and other soft tissue techniques also.
Okay, one important thing that from your presentation is that related to stress. That's mean that psychological and social impact are the main. I always say that main indication for this therapy. Is that right, Professor Mehta?
No, not psychosocial only, sir. All the types of impact. Because see, we are just going behind the global situation, global crisis, and everywhere just see the war is going on the Ukraine. So many things are there. Everywhere we can see the because challenging world. Okay, risky evolution is there. We have to change our economy also. Work related stress is there. Then physical stress is also there. We are not giving more time for our body's function, body's activity. We are just going behind the. So lot of things are there, and small things we are taking the medicines for small problems. If we have some joint pain, so all these things, our posture, mostly 80% people having some postural problems with their postures. Okay, not proper posture in the office pattern also, not proper posture in the walking pattern also. Lot of the static posture also, dynamic. So we can correct the posture also. If automatically your posture will correct, you will correct so many problems. Everything related, all the body dynamics and biomechanics related with your posture only. So I have seen a lot of patients with the postural problem. When I will correct, I will work with all these soft tissue. We are able to correct the postural problems also. So automatically there, all the problems will correct.
Okay, and then saya kira saya tidak punya banyak, saya banyak mencatat tapi saya tidak banyak waktu lagi. Beliau menjelaskan tentang osteopati ya, osteopati penggunaannya, risikonya. Beliau menjelaskan tentang soft tissue teknik, indication for soft myofascial result teknik. Saya kira semuanya sudah ini. Kalau ada pertanyaan, any question, ya, silahkan langsung. Bisa juga tulis di chat ya. Silahkan.
Pak Arsyad, ini ada pertanyaan dari Ilhamuddin. Sebentar saya bacakan. Izin bertanya, adakah cara untuk self therapy or self training?
Professor Mehta, there is a question. Is there any chance for self therapy or something like that, self training? Pak Rizky, itu benar ya? Itu maksudnya
self training. Yes.
Self training.
No, see, soft tissue manipulation you have to do. We only have to do by our hands. Self therapy, you can tell them to some ways to relax at home and at workplace, or you can do some psychological counseling also, or you can teach them some of the self movement pattern, like I told you, the position release technique. Okay, so there is no need for doing any manipulation of position thing. But other movements, whatever we are doing with the soft tissues like ligaments, bones, muscles, we have to do by our hands, fascias, then membrane, spinal cord, capsules. But like positions, we can teach them, or some of the advice for home exercise we can give them, or some of the advice regarding to their lifestyle. Just a betterment we can give them, how they will relax in their lifestyle at workplace. But movements wherever needed by our hands, just to mobilize the soft tissue, either the bones, ligament, muscles, fascia, we have to do by our hands only.
Okay. Thank you, Professor. Thank you. And another important question I see from SMS. Can this therapy, osteopathy and craniosacral, combine with other therapy, for example, acupuncture? And if so, what's this impact, a negative impact or side effects of this if we combine this?
See, mainly visceral manipulation, craniosacral therapy, osteopathy, chiropathy, we are not using any external devices, any external things. We are doing all the movements with our hands. But the acupuncture, we are using mainly the needles. Okay. So principles of for both the therapies, they see the basic principles are the physiological principles are a little bit same for all the types of the alternative medicines, not only the acupuncture, but here we are using all the movements we are doing with the hands only. Acupuncture we are using the needles also. We are just puncturing some of the points as per the anatomy of our body. So physiological principle, either you are doing all the alternative medicine, either you are going for the acupuncture, naturopathy, any pain relief modalities, any exercise therapy. The physiological principles are little bit same, but the methods are different. Okay.
Oke, terakhir pertanyaan dari audiens. Apakah ada pertanyaan sebelum saya kembalikan ke Pak Rizky Basuki? Silakan.
Izin bertanya, Pak.
Silakan.
Ya, terima kasih Pak untuk waktu dan kesempatannya. Jadi izin untuk bahasa Indonesia Pak ya.
Ya.
Kan tadi untuk manual terapinya kan menggunakan beberapa teknik, apalagi yang ketika manipulasi dari torakalnya Pak. Apakah ada handling khusus ketika melakukan tadi HFLA, yang tadi high velocity low amplitude? Karena ketika kan kondisi ada yang handlingnya tuh macam-macam. Apalagi semisal terapisnya ini berbadan kecil dan pasien berbadan besar, itu positioningnya seperti apa Pak? Mungkin itu aja Pak, terima kasih.
Okay. The main question is, there is HPA, HPA ya, Pak Rizky ya?
HFLA-nya tadi Pak, ketika diberikan adjustment, tadi kan ada
adjustment.
Ketika ada adjustment.
Adjustment, especially if the therapist is very big and the patient is very small, or the therapist is very small and the patient are very big. Professor
Yeah, we can treat. See, sometimes you will get the patient of 100 kg and therapist only 50 kg. In physiotherapy practice, also sometimes you will get the opposite pattern. See, here we can treat. Why? See, if we are not able to lift the patient properly, we can use some pillows and towels, or we can change the position of the patient. Because stretching we can do by so many ways. Okay. Sometimes we can go for self-stretching also. Sometimes we can do stretching with the help of our hand also. Sometimes we will do the stretching with the help of TheraBand also. Okay. So here we are not penetrating anything in our body. If you want some pillows, some TheraBand, some belt, you can use for because chiropathy, osteopathy, sometimes we are using the belts also. Okay, sometimes, but not injecting, not penetrating inside your body. All the things you are supporting device like belt or some band you want to use, you can use. But you can change the different position of the patient, and you can treat the heavy and obese patient also. It doesn't matter. Okay. So by the positioning, doing in the proper position, age per the need of the patient, we can treat all the patient.
Okay, thank you so much, Profesor Mehta. Masih banyak pertanyaan dari teman-teman, tapi kita ke time constraint, kita ke batas waktu ya. We have another speakers. Saya kira kalau ada pertanyaan, if you have any question, please just send email or message. Pak Wahyu Sadikin, kemudian Pak Umar Gorontalo.
See, somebody written like a craniosacral technique to the tissue, how light we touch that. See, we will have to apply the very light pressure, because here we are dealing with the membranes and fluids, we are dealing with the soft tissue. But the rest of the things I can teach in practical only. By here we should not apply that, because I told you so many times the contraindication.
Yeah.
Here you are doing all the movements to correct the body's pattern, not to just discorrect the body's pattern. So you always remember about the duration of the force and the quality of force also, and quantity of force also. Okay, and the right pattern you should apply. The direction of the force also very important here. So just take care about it.
Professor Sailendra Mehta, I'm really sorry because this is really important information, excellent presentation. And then we will continue on June. Again, we will continue on June in Jakarta, Indonesia. So, if you have any question, kalau ada pertanyaan dari teman-teman yang lain, silahkan dikirim ke Pak Rizky Basuki. Silahkan ke. So, again, thank you so much, Professor Sailendra Mehta.
Thank you, Dr. Arshad. Thank you.
Yeah, we will meet, and then we really hope you to come to Indonesia to share this really important. We don't have time here, so thank you so much. And then back to you, Mr. Rizky Basuki. Take care again. Over to you, please.
Okay. Thank you, Dr. Sailendra Mehta, and thank you,
Dr. Rizky, organizer.
Thank you
Dr.
very
Rizky.
much. It's very good presentation. And the enthusiastic is very good. Hopefully, with this introduction, everyone will come at June, which is your workshop, and we will study together later. Okay. Thank you once again. Thank you, Dr. Sailendra Mehta. Okay.
Thank you, sir. Thank
Okay,
you, Dr. Imam, Dr. Arshad, and Dr. Rizky, and all the organizers of Manual.
Thank you, Professor. Thank you, Professor.